Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Well, hello everybody once again. We're so happy you're here in our ever-growing audience, aren't we, Mark?
Our audience is actually amazing.
It is.
And you know what grew it? It was distributing the announcement on the right day of the week.
Oh, well.
It was something that random.
Sort of the monkey playing dartboard or something.
Exactly.
Yeah. Well, anyway, those of you who are tuned into this are in for a real treat today. We have one of the stars in the dental world with us, and she's going to talk with us and you about a bunch of stuff. This would be none other than Sandy Pardue of Classic Practice Resources. Hi, Sandy. Welcome.
Hi, Howie and Mark. It's great to be here.
You're down in Louisiana, right?
I am.
I always smile when I hear her voice. I just smile.
You can't not smile.
I know.
Hi,
yeah. Sandy. How are you?
I'm doing really well.
Good. There's 2 hurricanes last week, and Louisiana got neither of them.
Oh, yes, and it's beautiful here, too. So
yeah, it's good. All right, so
yeah, go ahead, Mark. Let's interview Sandy and see what gems we can pull out of her.
Yeah. Let's see what's going on in the world of dentistry.
Okay, I'm ready.
All right, so I want to frame this so that the focus is on you and your work. I've known you for I don't know how many dozen years now, and I know your clients, and I know your business, and I know, well, I've been to and I know your daughter. I know a whole bunch to know about Classic Practice Resources, and you guys do a phenomenal job.
Okay.
Absolutely.
And it deserves accolades, and it deserves the attention of other dentists out there when you speak. So I'm going to use this time wisely, and I'm going to try to remove as much as I can the marketing element of this, and I want to move it over to the practice management element, which is your forte.
Okay.
And but I do want to point out that there's a very rich partnership between when a dentist says me and my team, or my team and I, they typically are representing themselves and their employees. And I would go so far as to say that most really successful dental practices on a consistent basis have more to their team. They have a marketing arm and they have a practice management arm. So when I say, my team or the team, I want to make sure we're aware before we go too much further that let's assume that the doctor and the team are doing the best they can right now, and let's assume that the marketing is working. Let's just make those assumptions, okay? I know they're pretty broad assumptions, but we have Sandy Pardue here, so I want to focus this in on what are dentists doing, or what do they need to do if they're spending money on marketing. How do they and their team get more from the opportunity to work with these new patients?
That's a great question. First off, they better have somebody answering the phone that is going to welcome that new patient, that's going to have the right tone of voice, which a lot of people don't really think about, that they can answer questions. I called an office recently, and I was doing some of my phantom calls, which I like to do, and I just couldn't even believe what I was hearing. And it's pretty entertaining, actually, but it's sad because the doctor that's made this huge investment is in the treatment room doing the dentistry, and then somebody's answering the phone that's telling me that they don't know if they can do something, or they don't know maybe that product is not good, and no, we just don't do it. I can give you the name of someone that can. Really?
Right.
Really?
Oh my God.
Okay, now what's the doctor going to say about that? So I'm doing these spam calls and I hear all these crazy things, things like, no, hang on a second, and really rude, and not asking me if I'd like to be put on hold or if I have time to be put on hold. Just hang on a second and then I'm on hold. And it's just crazy what we hear when we call these practices, and so unfair to the doctor. But it's due to no training. So they hire Susie, they get her in, they put her at the phone, and they give her no training. I just can't even believe that.
Right.
Well, we've seen that before, Mark. You and I, and that's what the doc fails to realize is that the very first impression that most people get, aside from like the mailing piece of the radio spot or whatever drew them to the practice, is the person who answers the phone. They're the most important person in the practice in that regard, right, Sandy?
It's true, and I think it takes about 5 to 10 seconds for a patient calling in to know if they're really going to make an appointment or even make one and maybe not even keep it. They pretty much know from that initial call. One of the calls that I made, the girl told me, she said, "No, you don't understand." And I'm thinking, really? She said, what we want to do is we want to get the patient in and meet the doctor for this 2-hour appointment. And
oh boy.
Oh man, guy, you cannot do this. So just so many mistakes, and it's so easy. In fact, I was giving a seminar recently, and one of the attendees raised her hand and she said, "I don't think that these are real calls to practices that you're playing, because what I like to do is play the calls and then see what they can find wrong." And I said, "Well, I tell you what, it's Friday. So I don't know how many practices will be in the office, but I tell you what we're going to do. Let's Google and get some practice names and numbers, and let's just call them live, right?"
Oh boy, that's fun.
Yeah. And they loved it.
Right.
And so we dialed it up and put it on speaker, and then I put my microphone up to my cell phone. And in fact, one of the offices gave me the number to call. And they said, "This is our competition, just a short distance from our office." And when the girl, now I said, "Oh, I have a toothache and I'm in pain, but I'm so scared to make an appointment. I'm scared to come in. I'm scared of the dentist." And she said to me, "Do you want an appointment or not?" And no, they couldn't believe it. So
no, believe it, because we listen to these calls all the time. They drive us crazy.
They couldn't even believe it. So this is what's happening, and it's really out of control. And these are good staff. These are good people, and they want to do well. That's the thing. The staff want to do well.
Right.
And they just need the tools. They need the tools so they can help the practice.
Yeah, how many different variations of answering the phone well are there? It's almost endless. But there's also, we see just basic operational functions not being handled. Like, here's an example. This is actually a classic example, and this happens in every practice. They put their voicemail on at lunch.
Oh man.
Okay,
Yeah.
and nobody bothers to come in and look at the caller ID from the hang-ups from the new patients.
Right.
Who called at lunchtime when you should have been in the office.
Right.
or somebody should have been answering the phones, okay?
That's a great one.
I mean, and that doesn't have anything to do with tone of voice. That doesn't have to, you could be the worst possible person on the phone and still at least put this phone number in front of a person who's good on the phone, right? I mean, even if you're the biggest sourpuss on earth,
right? At
least do that for your practice and give that to someone who's really good on the phone, and have that person follow up with that new patient appointment who just hung up. That's right.
You mentioned answering machines. So there's something that I hear in the dental industry that just I can't even take it when I hear this. and it's oh, somebody will say, there's this great idea. What you do is you put a message on your answering machine. This machine does not accept cancellations.
How
I
stupid
don't
is that?
understand this.
Right.
Now, okay. Wouldn't you want to know that your patient that's supposed to come at 2:00 today for 2 hours had a gallbladder attack, and now maybe you can get someone else in there?
Right.
It's like, wouldn't you want to know if someone's not coming? And that doesn't solve any problems.
No, it just creates them.
Yes.
Yes.
So to the listeners, please, if you have that on your answering machine, take it off. Take it off right now. Change your message.
Yeah, because we don't accept people with those messages on their answer.
Yeah.
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 I mean, wow.
This machine will stop recording if you try to cancel your appointment.
That's right. That's right.
But so what's happening is you hear, like, you can go to the dental chat rooms, and you can see a lot of times where the doctors are coming in and they're talking about broken appointments. Just this morning,
Right.
Somebody I saw on Dental Town that somebody was saying, boy, I'm having 2 and 3 broken appointments every day in hygiene. And they want to blame the patient, but it's not the patient's fault. It's a lack of control within the practice. It's a lack of systems.
Yep. Yeah, and the marketing part of the team would say it could be as marketing too.
Well, the thing is, again, when it dealing with marketing is going to get the patients in, get them to call, okay, but to become a patient, and that's what the marketing is supposed to do. But it's okay, so they hand over the patients to you, but what are you doing to the patients?
No,
to
I
make
know.
them leave out the back door.
I know. And okay, so here in a I guess in a macro sense, all across the U.S., is we're seeing a rebound in dentistry. Now, I know as a consultant, and you have long-term relationships with your clients, just like we do. I'm sure you have clients been with Classic Practice for 5, 6, 10 years. So I know you see, an overview, a macro look at what's going on in dentistry. From a marketing standpoint, we saw, kind of craziness after 2008 when everybody was scrambling not to be a cosmetic dentist anymore.
Right, right.
But then it, flattened out, and then because basically dentistry lost 18% of its GDP, after 2008 hit,
right.
and that's going to impact every dentist. I don't care who you are, but so you're seeing that you're seeing steadiness in the dental industry. We're seeing renewed growth from the marketing side. And what you think, that's probably also aggravating these staff issues, wouldn't you say? Because, the more people that call, the more aggravated you're going to get, right? And the more damage you're going to see, right? This is an assumption. I'm just looking for your...
Yes, but I'll tell you, the main thing, and you mentioned like these practices that are struggling and floundering or staying flat.
Right.
Guys, the missed opportunities in these practices, that's another thing. I mean, you see them, they're maybe flat and they get the new patients in and they run them off. Some of them, they're not taking care of them. They lack the systems to retain the patients. But you see people posting, oh, I don't have anybody to come in. My schedule's empty. But I'll ask them, hey, listen, go to the computer, pull a report of the diagnosed unscheduled treatment from the last 12 months.
Exactly.
It's $700,000.
Right.
Okay. I don't have anybody to put in the schedule. Pull me a report. Let's look at overdue recall. There's 500 people that need to come in today. Yeah. So these are all missed opportunities. So you guys do a great job with marketing. And I've got clients that use you guys and they are very, very happy. And you're bringing in the new patients. And now the practice has to have the know-how to keep them.
Right. That's how we work together, in that we, like, if you have a client that uses us and we have a client that uses you, then we know they're going to squeeze as much out of that marketing dollar as humanly possible. And you know that the patients we generate aren't shoppers, right? So it's going to help your end and help the treatment compliance and the recall compliance on your end. So all this stuff works together. But yeah, no, the open door is, you're saying the back door is open.
Oh, the back door is open like crazy.
Right.
And, I'm seeing patient retention at 40 and 50% in practices.
Mm-hmm.
And so they're leaving and they're not, and I saw this, read this article from U.S. News and World Report, and they were talking about why customers quit. And I thought it was really interesting because they said like 68% of customers leave because of attitude of indifference or even bad attitudes of the staff.
Right.
So that's crazy.
Oh,
Right.
boy.
68%. So that tells us what we need to work on in the practice.
Right.
No kidding. You know what? Might be a good time for us to take a little break. And you hang on, Sandy, and you hang on in the audience. We will be right back. We hope you're enjoying our podcast. Let me ask you, do you have a roadmap for your marketing? Why not let New Patients Incorporated do it for you? Our marketing plans have been proven effective for over 27 years for hundreds of practices across lots of different countries. We will give you the marketing data for your area, a marketing budget. We'll show you how to allocate your budget, and then we will show you the proper deployment strategies for each medium. Click on the header where it says Complimentary Marketing Plan when you go to www.newpatientsincorporated. Okay, we are back with Sandy Pardue of Classic Practice Resources. Sandy, you were talking about the attitude of the staff has a huge effect on whether or not the customer shows up.
Yes.
Stays with the practice, right?
Hey, Sandy.
Yes.
Doesn't the attitude of the staff, doesn't that kind of come from the attitude of the leadership as well?
Oh my goodness, yes. Great point, Mark. Absolutely. Because a lot of times dentists think that they can hire staff. Oh, they worked down the street for this dentist that was doing $2 million. If I get those staff in here with me, I'll have it made and I can just stay in the operatory and I can see patients and I can do my endo procedures that I love and I don't have to worry about the business anymore. And that is bull.
Right.
It does not work like that.
Right.
So it's your business. You own the business and you have to tell the staff what you expect. It's okay to have fun. Of course, I want you to have fun. I want you to enjoy what you do, but somebody's got to be the leader and it can't be the staff.
Right. Yeah, because if they have an attitude on the phone somewhere along the way, there's either a complacent dentist or a dentist who knows and is just afraid to confront, right?
Because they might quit.
Right, or an associate. Because I can't imagine a business owner, no matter how shy or reserved they are, not taking immediate and swift action at some of these calls that you and I both hear.
This is reminds me of a call I had Friday where a dentist called me and said that she was working in a practice with 8 staff and it was a corporate practice.
Right.
And she said that she called and said, I need leadership training. So the more I spoke with her and learned a little bit about her situation, my advice was to quit. Because basically she said that the owners said, do not ever discipline the staff or get mad at them for being late. She said they come in like 20 minutes late, 30 minutes late. They're late from lunch. She said she can't do anything. They kind of just do whatever and they don't respect her. And she said they'll make fun of her right in front of her. And the owner said, don't do anything. So, yeah, she needs to move on.
Yeah, absolutely.
But that being said, this whole leadership thing, it's like what I see is the the dentist, and I mentioned a little bit of this, but I want to say it again. When you hire someone, ideally you've got structure in your practice and you've got your systems where you can hire someone with specific protocols. You know who they are, you know their ability, and you plug them in versus what many practices do, and that is hire someone in hoping that they bring all your solutions.
Right.
But I'm telling you that can't happen, but I'm also going to tell you, and you might say, well, she's talking out of both sides of her mouth, but no, that person that you hire and put at the front, well, they are also the one that will determine your income, what kind of car you drive, what kind of house you live in.
Right.
But with the leadership.
Yeah, nothing happens of a revenue consequence in a practice until or unless the phone rings, and then how that's handled is supremely important. That you nailed it.
And treatment presentation and follow up. Whenever I ask these people that, they'll call and say, well, Sandy, my schedule is empty. Well, how many calls are going out every day? What do you mean? What do you mean? Confirmation calls?
Ew, calls? Ew,
yeah.
ew.
None. We're not doing any. Okay. Well, that could be part of the problem.
Yeah, it could be. So, all right. So we have patient inquiries coming in. We have staffing is one of the main barriers. I think everyone listening to this podcast would definitely agree. I know from our perspective, we run into our own clients who don't even want to listen because they're afraid. They don't want to listen to the recordings of the calls.
Yeah.
Because they're afraid. And mostly what they're afraid of is now they are afraid of the truth. And the truth is that they're now going to have to confront the person that they liked yesterday.
Yeah, you really hit it there, Mark. Because what happens is the staff, that's another thing. The staff puts pressure on the dentist.
Yeah. And
I'm going to quit. If they're going to record me, I'm going to quit. I'm not going to work here. Right. And so what we do is we've recorded some, depending on the state, but we've stopped the recording and we'll call and then evaluate and send that in.
Right.
And that's been working really well, along with the coaching and then our, the drill training videos that we now have. So that helps. But what happens is, another thing I want to say is that a lot of practices give patients a guilt trip. They call in and make them feel bad about their mouths. So we already know that less than half the people are going to the dentist, right? So then they finally get up the nerve to go, okay, they get this marketing piece, they see this, and they say, you know what, I might like that practice. Let me check them out. Their website looks good. I'm going to call. So the first thing they hear is, well, when was the last time you saw a dentist? And the poor guy's thinking, well, it's been 7 years.
Yeah. When was Jimmy Carter around?
Yeah. Or, or when was the last time you had your teeth cleaned? Mm-hmm. And if you break this appointment, we're going to charge you $75.
Oh, geez. Right.
And so that's how they're starting these relationships.
No, I know.
Yeah, that ends them too, right there.
Especially when they get in the hygiene chair and the hygienist shakes her finger and says, did you floss today?
Right.
So we ought to not have little signs hanging around the office saying, well, when was the last time you flossed?
Right.
Because the reality is, in the real world, people are not lined up outside of any practice waiting to come in.
That's right.
And you guys can do your part and get them to call and get them to want to go there, but it can all stop with that initial contact within 5 to 10 seconds.
Exactly. Well, now, Sandy, doesn't classic practice have you guys have destination courses that people can send?
We do.
They can send their staff to. Do you have any of those scheduled now?
We do. We have a Spice Up Your Practice, and that's going to be in November in New Orleans. It's going to be on the 3rd and 4th of November. And then we'll be naming new dates for 2018 really soon. And we have an Academy of Scheduling Excellence, which is great for the team. It's a day and a half, and it's team training with role playing. And I send them back ready to handle these front desk situations and systems, all the systems that the front desk with new patients and scheduling and insurance and collections and just improving accounts receivable and treatment plan presentation. And my favorite, recall and reactivation.
Okay, and that's so that the 2018 schedule is not out yet, but it's going to be out.
No, it'll be on our website.
It'll be on your website.
And I cover those topics at the Spice Up Your Practice.
Oh, okay. And just for the, I mean, I know what it is, but just for the listeners, what's your website domain?
It's classicpractice.com. Classic, like a classic car, practice like you practice the piano.com.
There you go. Sandy, we have to do this. We're out of time, but
this is just part one.
Yeah, we got to do this every 3 or 4 months.
We're going to rope you in for another one.
Yeah, I mean, this is the down home, real, no fluff, even sometimes in your face if it's the truth, right? This is the kind of stuff, right, that dentists need to hear.
It's all about results, Mark.
I know.
Results. Yeah.
I know, but there's so much fluff out there that what we try to do, outside of promoting ourselves, obviously, but what we try to do with these podcasts is it's making it real. And when we get you on the phone or we get you on a podcast, it's like us. I mean, we're just real. No doctor, you can't do it that way, and here's why. And whatever, it's just the truth. Right. So we got to do this every 3 or 4 months. So, and I know how busy your schedule is, so I'll send Dana a bottle of wine or something, and
we'll bribe you.
We'll just bribe.
Yeah, I'm happy to do it.
Well, thank you, Sandy, and that'll wrap up things for today. We certainly appreciate you being with us, and we know our audience does as well. So, to our audience, we will see you again soon. Hang in there now. Bye now. We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and New Patients Inc.